Welcome to today's press briefing. We have two doctors with us today, Dr. Zhang Shokwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Larry Lee, Chief Manager of Hospital Authority. They will give you an update on HA situation and COVID cases. We give the floor to Dr. Lee. On behalf of the Hospital Authority, I'd like to wish everybody good health and peace in this Mid-Autumn Festival, and let me also remind everyone to continue to observe social distancing measures. We have 2,698 patients in our system, with 333 being new cases. For those requiring isolation facilities, 477 are in isolation wards, 191 in isolation wards, and 554 in Hong Kong North End Hospital, Hong Kong Regional Center, and also 201 at the treatment center of Asia World Expo, the 228 cases of which are new cases. As of yesterday, there are 5 patients in critical condition. 3 had 3 jabs, 2 did not have vaccination records, and 9 more patients in serious condition. Among the inpatients, there are 53 in critical condition, 53 in serious condition, and 16 patients in critical condition are in intensive care. We have also reported 8 death cases, 2 males, 6 females, 21 to 99 years old. 3 of the deceased did not complete the 3-dose regime, and 2 were care home residents. We believe the causes of death of 5 of the 8 patients had direct correlation with COVID. We start with the first 5 cases. 89-year-old female with 3 jabs, had a history of cardiac failure, heart failure, DM, and hypertension. She was admitted to Queen Elizabeth Hospital because of fever and coughing. And on hospital admission screening, she tested positive. Her blood oxygen level continued to drop, and she passed away in the evening of the 8th of September. 95-year-old male patient, no vaccination record. He had dementia and heart failure, and he was admitted to Yanchai Hospital in the unit, and he was admitted because of fever and coughing. Examination revealed opacity. He tested both PCR and RAT positive, and he had a lung condition and heart failure together with COVID. So in the small hours of the 9th of September, he passed away. 21-year-old male patient, no vaccination record. He was a chronically ill patient. He had a stroke and he was bedbound. He was admitted to United Christian Hospital on the 8th of September because of shortness of breath and fever. And he lost consciousness on admission to hospital, and X-ray examination revealed pneumonia. He had a cardiac shock, and then at about 4 a.m. on the 9th of September, he passed away. 95-year-old female patient, a care home resident. She had 3 jabs, and she had a heart condition and dementia. She was admitted to Kwong Wah Hospital with low blood oxygen level and fever, and on the 4th of September, her condition improved and she was transferred to the Hong Kong North End Hospital HCC Center, and then her condition deteriorated and she passed away in the morning of the 9th. And then another female patient, aged 99 years, she had 3 jabs and she was subject to isolation in Asia World Expo. She had fever and coughs, and then she was transmitted to treatment hospital. She had pneumonia and she also tested PCR positive. She passed away in the morning of the 9th of September. And the causes of death of the 3 other cases do not have direct correlation with COVID in our view. The first patient, 86-year-old female patient, admitted to Eastern Hospital via A&E unit. She had fever and shortness of breath. Bacteria were cultivated in both her urine and blood samples, and we believe that she had urethritis. And then the next patient, she had 3 jabs. She had a terminal stage liver cancer. She was admitted to hospital because of pulmonary edema, and she passed away on the 9th of September. We believe that her passing away had to do with her cancer. And then 83-year-old female patient, 3 jabs, hypertension, DM, and also renal impairment. She was admitted transferred to Prince of Wales Hospital via a unit. She tested both positive for PCR and RAT. Because of poor appetite, she was admitted to hospital. Her renal function deteriorated, causing her to be admitted, and then she passed away in the morning of the 9th of September. As of yesterday, 386 patients have recovered, and 347 of them have been discharged, and 3 patients have tested positive on hospital admission screening. 8 sharing the same ward have been listed as close contacts. We have 155 more HA staff members testing positive, and 115 returning to their position. We recorded 9,602 local infections, including 2,277 PCR positive cases and 7,325 RAT positive cases. We also recorded 185 imported cases, including 162 PCR positive and 23 RAT positive cases. Among the 185 imported cases, 81 of them were picked up at the airport, 53 picked up at quarantine hotels or quarantine centers, and also 41 picked up for the 4th to 7th day specimens collected by the CTCs, and also 10 more specimens picked up for the 8th to 10 days specimen. They were imported from 36 places, from Philippines 28, and then UK 18. As for the remaining 33 places, they imported less than 10 cases. As reported by Dr. Lee, we received 8 death reports, and since the 5th wave, there have been 9,575 deaths. And yesterday, 5 residential care homes for the elderly and 5 for the disabled reported 9 cases involving residents and 1 staff member being infected. 71 residents will be subject to quarantine. The 3 RCHs and 3 RCHDs are as follows: Sham Shui Po, Lock Lin Elderly Home, Kwun Tong Shui On Company Limited, Kwai Chung Yu Dat Elderly Home, and then Jiwen Gan Sam Yi Wu Lou Yuan in Chimen North District, Tin Ping Elderly Home, Tuen Mun New Psychiatric Association, San Ging Hostel, Kwun Tong Hong Shui Hostel, and Kwun Tong Lun Se Fu Dao Hui Sun Tien Hostel. For schools, it's not a school day. Today is Saturday, but yesterday afternoon and this morning, we have received reports, and some classes in some schools will be suspended. So in these 2 days, 17 classes from 16 schools have been suspended, including 4 kindergartens, 6 primary schools, 6 secondary schools. Earlier, we suspended 2 classes of a school. Now a 3rd class has emerged. South Island School, that's a secondary school in Southern District. 8B1, that's the class, 20 students in total, and we have received reports from 3 students being infected, and we will advise this class to suspend for a week as well. As for subvariants, for L452R suspected to be BA.4.5 cases, the percentage now has risen to 74.6% as of the 7th of September. And according to the Public Health Laboratory Service, among the L452R, that is between specimens collected between the 4th and 11th, 88.5% belong to BA.5 and 11.5% belong to BA.4 subtype. As for the other subvariants, I mean, BA.5 accounts for 66% of all infections, BA.2, 20%, and then BA.2.12.1, 5.4%. So may I wish everybody a happy Mid-Autumn Festival as well.
Floor is now open to questions. Before putting your questions, please identify your media outlet. On the right, the gentleman in the middle. I'm from News. Happy Mid-Autumn Festival to both doctors. It's Mid-Autumn Festival today. Many people will attend family gatherings. Has the Department of Health assessed whether there's a major outbreak after the festival? Will there be 15,000 cases per day after the festival? The vaccine pass has been expanded to cover younger children. Many parents are bringing their children to get vaccinated. How many children have been vaccinated over the past couple of days? How's the response? Any data available? It's a holiday today. Some people may be attending cross-family gatherings. If possible, people should avoid such gatherings. If they do attend such gatherings, they should do a rapid antigen test beforehand. If they test RT positive, they should declare the result and stay away from such gatherings. If they develop symptoms, and even if they do have an RT negative result, they could have been infected, and it's just that the RT fails to pick up the infection, so they should still stay away from gatherings. It's hard to say whether there will be further rises in daily infections after the Mid-Autumn Festival. That's not something we would wish to see. For children, I don't have vaccination figures about children. Next question on the right, a lady at the front. I'm from Now TV. First question, the school, South Island School. Previously, some classes had infections, so in-person learning was suspended. Are there links between these cases? Is there a need for a school-wide suspension at this school? Just then, there is this case, 21-year-old, whose cause of death is suspected to be linked to COVID. He had chronic illnesses. Why is it assessed that his death may have to do with COVID? For the cardiac shock, is it caused by COVID? Last question about the vaccine pass. Starting from November 30th, the grace period between the second and third jab will be cancelled. For those who have got the second jab but then fewer than 2 months has elapsed and they're asked to take the third jab, will there be higher risk for myocardial infarction for them? For these people, if they don't have the third jab, would it be barred from some premises? Aren't you punishing those who are getting the vaccination late? For South Island School, there are 3 classes involved. We don't see clear links between the classes. For each class, 3 students got infected and then class suspension was recommended. We don't see any epidemiological links between these classes. As for the vaccine pass, it depends on the kind of vaccine people are getting. It would be nice if people could follow the timetable that we have recommended. There is ample time for most people to get all their jabs. Next question. For the 21-year-old patient, he had chronic illnesses. On September 7th, he tested RT positive. On September 8th, he was admitted to the A&E department at the United Christian Hospital. His death is more likely to be something that has to do with COVID. He had a cardiac shock. His X-ray shows chronic glass opacity and pneumonia. He had a recent infection, and he had no vaccination records. That's why, from all these circumstances, we believe this is a case of COVID triggering respiratory failure and leading to his death. Next question, we'll take an English question on the right, lady at the back.
Hi, good afternoon. Laura Westbrook from the South China Morning Post. I have 3 questions. The first one is about the government seeking expressions of interest from hotels for the 9th cycle, which ends in February next year. Does this mean that quarantine will continue against until next year? And do you think the current rules should remain in place given the number of imported cases compared to local cases? The imported cases are quite low compared. The second question is the government noted yesterday that flight crew who tested positive was minimal. Do you think there should be further easing of quarantine arrangements for flight crew, for example, for foreign flight crew who lay over in Hong Kong? And then the final question is Peter Wu, Henry Tang, a coalition of airlines have all called for a roadmap or a timeline this week for further easing of quarantine rules. In your view, do you think this is a good idea? And if so, why?
I think your three questions are all pointed to similar things. So I understand the government is closely monitoring all these quarantine measures for imported travelers, air crews, and so on. And the government will balance all the factors, and if necessary, will announce new measures as soon as possible.
Next question. On the right, the lady at the back. I'm from Mingpao. At the North Atlanta Hospital Infection Control Center, there are 800 beds. How many healthcare workers are there? Would there be a shortage of staff? Now, the previous CEO of the hospital authority, Dr. Leung Pak-yin, some patients may have their own health conditions. If they test negative, they should be removed from the hospitalization figures. Will the hospital authority reassess how tallies are arrived at in terms of the hospitalization? At which point will such data be reviewed? Now, for the increase in hospitalization figures, if they're not staying at isolation facilities, where are they staying? What kind of patients are they? Are they staying at COVID beds? For the newly reported COVID patients staying at the hospital, would such figures be a better indicator of where the number of COVID patients? Dr. Kwan said today that the antibodies children acquire will only stay for 2 to 4 months. Do we see an increase in reinfection cases among children? Now, for the North Atlanta Hospital Hong Kong Infection Control Center, there are 11 wards, 768 beds in total. There are roughly 300 nurses. As for doctors, roughly 32 doctors there. We have learned our lessons from previous experience. We have looked at the severity of the condition of the patients there, but we do have the ample medical workers there. I will not comment on views put forward by individuals. In terms of arriving at the COVID figures, we take the 28-day rule of thumb. There is no perfect way to arrive at such figures. The current practice best reflects the kind of pressure on our public healthcare system. I don't have the figures on reinfection cases. Next question, on the left, a gentleman over there. I'm from Cable News. For aircrew members, their quarantine is done after 3 days, but inbound travelers will have to undergo hotel quarantine. Does it mean that aircrew members are at a low risk of transmitting a virus to local community, leading to such a practice? For aircrew members, they are under a closed-loop management when they are overseas. They try to avoid entering the local communities. So that's different from the situation with inbound travelers. So that's why aircrew members are at a relatively lower risk of infection. Any other questions? That concludes our press briefing today. Thank you.